Residents in care homes may become unwell. When deterioration is recognised by care teams, it is important to respond and communicate with other services. How well do you communicate with other services? You're about to see some examples of a call handled poorly. Do you recognise any of these behaviours in yourself or in your colleagues?
Ring, 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 ring.
Hello, Care Support Team, Jill speaking.
Hey, sorry, who's that?
It's Jill, one of the matrons. Can I help you? Jill Slater.
Oh, yeah, well, I don't really know because I've just come out of Andover and I'm ringing about this Marjorie Pickles Pinkle, I don't.
What's the date of birth?
1 minute, I'll have to go on to my PCS system, but, my password. Yeah, just 1 minute, sorry, bear with me.
Okay.
1 minute, because I feel panicked.
Oh, tell me what's been happening then, Mark.
Well, I don't really know because on handover it was just a bit bad, but apparently she's just a bit more confused. I've got some obs, but I can't really tell what they are. I don't even know what these mean.
Unfortunately, I can't triage her if we're not sure you're giving me the right observations.
As I say, I've just got told to call you because of that. So what do you want me? I don't know what to do now.
Okay, well.
Were you able to identify what was wrong with that phone call? How about when you make the phone call? Do you know what these services will ask you? Are you prepared to make the call? Do you have the information you need to hand? Do you know what to say? You're about to see an example of a call handled well.
Ring, 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 ring.
Hello, Katie speaking.
Oh, hiya Katie, my name's Caroline. I'm one of the paramedics with North West Ambulance Service.
Hi.
Hiya, I'm just ringing about the call to North West Ambulance Service today for a patient called Gilly.
Hi, yes, Katie speaking.
Hi, and can I ask what your position is, Katie?
I'm the senior carer.
Oh, lovely. And can you just confirm Gilly's full details for me and her address and her date of birth?
Yeah, it's Ray Sunshine Care Home, number 1 Mary Lane. Her date of birth is the 1st of the 12th, 56.
That's lovely, thank you. And do I have consent to pass Gilly's details to any other care providers or healthcare professionals if I need to?
Yeah, I've got that consent already. She's here with me.
That's great, thank you for that. And just to let you know that the call is recorded and we are just trying to arrange the right care for you today. Is that okay?
Yeah, perfect, thank you.
That's lovely. I know you said that Gilly's in the room with you. Would you just be able to pass her the phone over so I can hear Gilly talking and just have a couple of words with Gilly?
Yeah. Just 1 second. Here you are, Gilly. This is the paramedic. Would you like to tell her that you give me consent to speak to you, yeah?
That's lovely. I've heard Gilly now. I'm happy with that. Does she appear to be responding normally to you today?
No, she's not her usual self.
Lovely. Can I just confirm that she's alert and breathing and she's a good colour?
Yes, she is.
That's great. Do you want to just tell me a little bit about what's happened and the reason for the call today, please?
Yeah, she's had a couple of falls recently and she's currently being treated on antibiotics for a UTI, but she is on day 5. She's showing some signs of new confusion. She's a bit off her food and she's not really mobilising as she ordinarily would. So we just feel that she may need some sort of intervention.
Okay, and does Gilly have an advanced care plan or a DNAR in place?
Yes, she's got a DNA CPR in place and she does have an advanced care plan. She would like to stay at home, but obviously if it's treatable, that's different.
Okay, that's her wishes. And does Gilly make all her own decisions for her health at the moment? Does she have capacity?
Yes, she does.
She does have mental capacity, that's lovely. And do you just want to tell me a little bit about her? Are you trained in Restore 2? Are you trained in News 2? Do you want to tell me what her current News score is, please?
Yeah, her News 2 score is currently coming out at 5. Okay. So we're going to do that again very shortly. Her temperature is 39, her pulse is 120, blood pressure is 140/80. And her rest rate's coming out at 24. Her SATs is looking okay, but they're 96, which is quite normal for her.
Okay. Is Gilly able to talk to you in full sentences at the moment?
Yeah, I mean, she's very tired and looking quite frail. I do have a clinical frailty score as well. That's gone up from 5, which is a normal, and it's now gone up out at 7.
Right, okay, so she has deteriorated a little bit, hasn't she?
Yeah.
That's lovely, thanks for your help with that. I'm now going to just put you on hold for a minute and arrange the right help for you. Okay, thank you.
All right, thanks very much.
Were you able to see the difference between these 2 phone calls? Which call do you think will result in the resident getting the most appropriate care? When you make a phone call or receive a phone call about a deteriorating resident, you will be asked to provide the following information, whether you are contacting the North West Ambulance Service or the community care team. You will need to provide your details, including your name and job title. The resident's details, including their name, date of birth and address of the care home. You will also need to share the details of whether the resident has consented to you contacting their service and whether they can share information with other care providers. You can then discuss the reasons you are calling, including what has happened, how does this compare to their background, and how has the resident changed. You may be asked simple triage questions about how the resident is presenting in front of you. You should share as well if a resident has any advanced care plans, including their DNA CPR status and whether the resident currently has capacity. You will also need to discuss their observations based on the News2 score or Restore 2 tool that you have used and what your assessment has told you about the resident.